The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thanks for joining Navides today for a live webinar, Revamping Healthcare Revenue Cycle with Intelligent Automation. My name is Shelley, and I will be your host for today's session. Our speaker is Alan Hester, President of Navides, who will be addressing today's topic shortly. Before we start, let me share some quick guidelines. If you face any trouble with the audio or video, please let us know using the chat window on the side of the control panel, and we will sort that out. If you have webinar specific questions, please use the question window. Feel free to raise those questions whenever you feel like it. If we don't have time to address them at the end of the session, we will be sure to get back to you via email. We will also send out the recording of the session, and the same recording will be available on our website for download. I'll now go ahead and open today's session with a brief introduction to Navitas. Founded in 2011, we aim to help businesses work at their peak efficiency with our intelligent automation platform. We offer vertical solutions to help empower companies of all sizes. And one of the biggest differentiators of our platform is that RPA, AI, and BPM capabilities are natively developed within the platform. So this key differentiator helps us enable our customers achieve end-to-end process automation, end-to-end competitive edge. We are also recognized by leading global research analysts such as Gartner, Forrester, and Everest Group. And now I'm going to hand it over to our speaker for today. Alan, over to you.
Thanks, Shaylee, and welcome everyone. Glad that you've taken the time to join us today. Hopefully this will end up being an informative and helpful session for you. So we're going to be talking about revenue cycle management and how intelligent automation can help you with that. So let's first take a look at some of the statistics around this market. So the US revenue cycle management market, which I don't know exactly how they clarify what exactly is revenue cycle management versus healthcare in general, but in the US, they're saying that in 2022, the value was 140.4 billion, and that's expected to expand at a growth rate of 10.3% at least through the year 2030. The artificial intelligence in healthcare market is 9.64 billion in 2022, and that's expected to reach just under 273 billion by 2030 at a growth rate of about 52%. And then the last number there is the global healthcare automation market. And that grew from 57 billion in 2022 to just over 63 billion that you see there in 2023. And that's growing at a growth rate of 10.8%. So you can see that all of these numbers are big, and getting bigger rapidly. And so that gives us some indication why we should be paying attention to revenue cycle management. And we're going to take the time today to look at what are the challenges, the opportunities that we have when we look at revenue cycle management and how intelligent automation can play into that. So hopefully some of the things that you see on the list here will be familiar to you, but these are just some of what we will call the key challenges in this space. There's always repetitive manual and sometimes paper-based processes that are a part of every work cycle. Problem that everyone is experiencing is shortage of workers. Healthcare, certainly no exception there. I think through the pandemic that started and still continues today. Data is everywhere. I think this is one of the main issues that we see with our healthcare customers is that there's so much data and it's so hard to get it correlated and combined into a common space where you can report on it in a meaningful way that it sometimes becomes really overwhelming trying to think through how you're going to deal with and best leverage the data that you have available. Always rising costs, changes to your workflow, increases in regulation. And another big one that we found in healthcare is the fact that you got so many systems that are in play here. There are a lot of customized solutions that are really tailored to doing a specific job, and they do it very well, but they don't always play nice with all of the other tools that you're using, especially when it comes to on the data level. So being able to get the data out of those and get it into other systems or getting data from other systems into that system is often a very complicated, time-consuming process. In many cases, it can be done, but it will take a lot of time and cost a lot of money because you're going to have to hire consultants and specialists, developers, all kinds of people in order to make things like that happen. And then ultimately, you know, a big problem across the board is things that are impacting your bottom line for various reasons. So we've talked about mistakes here, but there are other reasons as well that can impact your bottom line. Just overall slowness of the manual processing has some impacts to your bottom line as well. So like I said, these are just some of the things that you might be encountering within your company, but you probably have others that you can think of right off the top of your head. So let's look at what we consider to be the 5 areas of opportunity within RCM for being able to apply intelligent automation. So the first one is eligibility verification. This is something that in many cases is taking a long time, even though it shouldn't, right? You have a lot of clearinghouses available, you have a lot of software available. There are a ton of tools in this space already that do this job. However, they don't work across the board. If you're fortunate enough to say, you know what, we have one tool and that does everything that we need to do in this space, I would say you are in the minority there. Most of the companies that we talk to and our customers, they're using multiple tools and still having to do some things manually as well, because the insurance companies don't make this process easy. They want you to do things their way. And so being able to leverage intelligent automation for this step can be a significant advantage. Now, one of the things that I didn't say before is that once we talk through these steps, we're going to look at a little demo of what automation of RCM can look like. So you will get to see, at least at a high level, the kinds of things that we're talking about. So if it doesn't make sense to you now, just hold on for a few minutes and we're going to get to that demo, and hopefully that will lock things into place for you. But keep in mind, everyone's a little bit different in how they develop this process internally, how they will ultimately want to automate it. So don't get hung up on the fact that little details that I talk about here or that I show you in the demo might not match exactly what you do. That's not really that big of a deal. So we talked about eligibility verification. The next one is medical coding and claim preparation. The coding process is something often you're relying on your billing partner for, or maybe you have an internal team doing that. This is an extremely high turnover area. If you have your own resources working in this space, there's a very large learning curve here. And usually once you get people up to speed and doing it very well, that's the point where they're ready to move on to something else. If you're using an external company, it's usually volume based. So if your volumes are small, it can be affordable. But as you scale up, it becomes quickly out of hand in terms of the costs that you're paying for that. So if that's something that you can automate and bring in-house, that can be a huge cost saver for you. The next one is claim submission. This is another area where the insurance companies don't make this easy. Everyone has their own portals, their own ways of doing things. So being able to automate that makes things much faster, easier to track, and also eliminates a lot of the chance of errors that can happen with manual processes. Dispute management, being able to build rules that are checking up on what you're doing so that it can bring things to your attention that you might want to get someone to look into as a manual exception process. That's a great way that you can leverage the technology in conjunction with the people that you have and make best use of both. And then the final step here, claim reconciliation. Being able to automate the claim payment reconciliation eliminates the errors and make sure that you get timely transfers of funds as well. So let's now take a break from the presentation, and I'm going to move over to the demo because I want to make sure that we don't run out of time. I want to show you the demo first. Okay. You may not be able to read that depending how big your screen is, but what we're looking at right now are the steps of this automation. The way the Nividus platform works is that you build end-to-end process automations by laying out the steps, and those can be steps that are automated steps performed by bots. They could be steps that are manual steps that are performed by humans, or some combination of those. And they could also involve different AI components as well. And so when you see this flow here, this shows you the live view of where you stand in this process. So you can see right now the green box is on patient registration, and that's where we're going to start this process. So, hold on a second. I didn't mean to do that. I clicked on something else and accidentally paused, but I think we're back in business here. Okay. So this is showing you the end-to-end workflow of this process from patient registration through billing and all the different steps. And we're going to walk through that whole cycle. So what you're seeing right here is the patient registration form being filled out And what you'll notice is that it's to this step right now to enter the medical card. And in this case, we have a picture of the medical card, but this could also be running on a mobile device and someone could take a picture live. But in either case, the relevant details from the card will be extracted from that automatically and entered into the appropriate fields on the screen. Obviously, there are some other fields that are not present on the card that have to be entered manually or pulled from another place if you have those available. The other thing that we're going to notice here is that when we get down just past the insurance information, and we're going to also complete all of the onboarding information as well. So this is an optional step. Maybe you have another system or tool that already does that. That's no problem. We've just incorporated it here in this demo to show you that if you want to build those things together, then you can certainly do that here. And obviously, your intake form might look a little bit different. You might have more options to select from. As I said before, there's no worries with that at all. So now what the bot is doing is it's taking that information that was entered in that patient registration step, and it's going to do an eligibility check based on that. So you can see it's logging in to the system here, and it's taking that information and not just getting the answer about whether or not that patient is eligible, but also capturing the full eligibility report and making that available to enter into the patient's record in the EHR. So you don't have to trust the fact that just because you see the checkbox there that the bot did its job. If you want to, you have all of the data available to review that. So we've gone through now the eligibility and the authorization steps, which were performed separately, but we just kind of breezed through both of them there. And now we're getting to the review step where the patient details are being reviewed, and then the patient visit itself will be conducted. You see now that we're logging into the EHR, we're making sure that that screenshot that was captured from the eligibility sheet gets recorded in the EHR in that patient record, so it's available for review later if needed. And this will then be available to the doctor during the visit, as well as any other appropriate or relevant information for the appointment or for the visit. So let me just stop here for a second, because this is something that we haven't really touched on, but the Nividus platform operates with a control center, which is the main interface for both bots and humans within the system, so that all the actions that are taking place are all tracked, and you have a full audit trail available. You also have the ability to do dashboards and reporting. So in this particular case, the view that you see on your screen now is giving you a high-level status of the RCM process and which of those flows are in which stages, and then even more detail listed down below. And you have the ability to do drill down type reports on this as well. But this is just a high level view to be able to say, okay, yeah, we have 5 appointments booked. We have 4 people that are in the visit stage. We have 12 that are ready to bill. Whatever those KPIs are that are most important to you, you can build into the system to make those most visible to you. So I just wanted to point that out. And again, don't be stuck on the fact that this might not match what's most important to you, because that can all be changed. Okay, so now we're going to get to the claim scrubbing step. And then we're going to go through claim review and claim submission. So you can see that this is information from the visit being logged in, and all of these codes that are being submitted, then we're going to be able to track both through the EHR, and then we will go through the payment posting process to verify that everything matches up, that all of the procedures or tests that were performed are properly billed and then properly paid for at the end. So this is an interesting step here, worth noting. The platform has the ability to do the multi-factor authentication for you. So you can see all these steps that we're watching on the screen are being performed by the bot, including this one. So the bot has the ability to do that multi-factor authentication, either using email or text message, or even app-based validation for that. So there's no problems with any of that. Now you can see we're logging into the bank website because we have the ability to reconcile the bank statement against the EOB. You might also have ERAs. That would be another way of doing this, but probably not everyone is paying through the same mechanism. So you have the flexibility to perform this process regardless of how the payment is being made. So now we're downloading the EOB details. And then that reconciliation process can be done, making sure that all of the proper codes have been billed for based on the visit information, and then any outstanding balance can be billed back to the patient in the final step. So I know that this is a lot to take in without taking the time to dive deeply into each step and explain in depth what's going on. And if you don't understand it completely, that's fine. This is something that we would be happy to walk you through in greater detail on your own, if that's interesting to you, or we're just happy to have a conversation about it in any case. So you can see now we're on that final step, patient billing in this process. And then as soon as that part is done, final bill is created, then the process will be completed. And here you can see in more detail the various kinds of KPIs that can be accounted for in the system. But again, if you don't see something that matches what you look at, then that's fine. That's something that can always be resolved. Let me switch back over to the presentation here. And actually, I'm going to take a minute here and ask a poll real quickly so I could see from the standpoint of our audience, what are the KPIs that you track to assess the effectiveness of your RCM process? So if you could just take a second to enter your answer there, and then I will move on. Wow, the internet must be slow today. It's taking a long time for it to say that the poll has been sent out. Okay, So I don't want to waste a whole lot of time with this. I wanted to just get a chance for you to give your feedback of the things that are important to you. So based on the responses so far, it looks like average days in AR is an important one. Let me close out the poll. Go back to the presentation. And we're going to look at our list of what we think some of the key indicators for automated RCM should be. So if this doesn't match up with what you thought your most important KPIs are, again, this is just based on our experience and not an indication of the only things that can be done with automation, intelligent automation within the RCM space. But you could see accounts receivable, wanting to ensure timely payment within 45 days, bad debt, improving the effectiveness of collections, discharge, not final bill, minimizing claim delays and improving cash flow, net collections, clean claim ratio, and then document processing is also a big one. We see a ton of practices and other professionals across the healthcare space that are still dealing with paper documents, with faxes, and a lot of things that introduce a lot of errors into the process. So let me just talk to you about the different technologies that are in play when we start talking about intelligent automation. And some of these you may have heard of, maybe all of them you have heard of. We're not going to go in great detail here. This isn't going to be a technical presentation. I just want to give you a high level idea of what these different components are and what they do. The first one's robotic process automation. And this is, sometimes you hear people talk about bots. When you talk about bots, this is what the bots are. So this is a software-based robot that's going to take a rules-driven task that is currently being done by a human and take it off their plate. Artificial intelligence can come alongside of that RPA to help it to be more effective by giving the ability to make higher level decisions. So whereas RPA on its own is very rules driven and the rules for the most part have to be pretty cut and dry, once you add artificial intelligence into the mix, you're capable of making more higher order decisions that can require more cognitive intelligence than just the bot on its own. The other thing that AI brings to the mix is the ability to retrieve meaningful content from unstructured data. So things like those paper documents that we were talking about or faxes. Artificial intelligence is the thing that can let you pull meaningful data out of that and then work with it in other systems. And then the last piece, which probably is the most obscure for most people, is something we call business process management or workflow technology. And this is what allows the humans to continue to play a role in the automated process. So when you look at a lot of the big RPA solutions out there, you will see that they're very good at doing this task-based automation, taking those individual human tasks off of the plate of humans, which is very time-saving and can achieve great ROI. But what they can't do is automate those entire business processes from end to end, like the RCM process, to accommodate both the automated steps performed by bots as well as the manual step performed by humans. Within the Nimbus platform, we have the ability to do that. The other thing that's really great about the Nimbus platform for a healthcare application is that unlike many of the other solutions that you're used to in the healthcare space, it's not tailored specifically just to healthcare solutions. So you could build your RCM automation on the Nividus platform and then still be able to use it for other things like back office type things. If you wanted to look at automations within your finance department or within IT or other areas of the business that can benefit from automation, you could do that without any additional investment in licenses, which can be a great cost save. So the Nividus platform itself embodies those different components using these elements. So we have Studio, which is the authoring environment, and everything is built there. And this makes it so that you don't have to retrain to learn a lot of other systems to do it. And also, I don't want to give the impression that you have to be able to build these automations on your own. You can do that. The Nividus platform is a low-code environment, so you don't necessarily have to be a developer to do this, but you can also leverage our professional services staff within Nividus or one of our partners to help you with these implementations as well, or even just to help your own staff get up and running with being able to do this for you in the long term, whatever works best for you. The control center we already talked about. That's the place where the bots and the humans are interacting with the system, and that's also the place where all the data is kept and reported on. The last piece we haven't talked about is the smart bot, and that's where all the artificial intelligence lives. So one thing worth noting is that all of these different elements of the Nividus platform are built by Nividus. They're not licensed from someone else. So that means that there are no extra licensing fees and there's no need to add extra components in. But the other thing that's worth noting is that the entire system is built in a modular and scalable way, so that if you do have some of these pieces already in place within your infrastructure, maybe you've already invested in some system that you want to continue to use, it's very easy to accommodate that within the Nividus platform. Okay. So this is just kind of a quick high-level snapshot of some of the benefits we've seen delivered in different RCM automation projects that we've done in our experience. And I'm not going to go through them in any great detail here because we're pretty much out of time. And I also want to at least be able to quickly flip through some case studies so that you can see the kind of results that we've been able to deliver in a more detailed way. If any of these are interesting to you, like I said, we'd be happy to go through these with you in more detail. You could also find most of these case studies on our website underneath case studies and healthcare. You will find these details. But if you want us to walk you through them, we're happy to do that as well. So we've had a tremendous amount of experience and success with automating RCM across a lot of different kinds of healthcare companies, different sizes. So we'd be happy to talk to you about how this could benefit your company as well. So at this point, I'm going to turn things back over to Shaylee so we can finish out our session.
All right. Thanks, Alan, for a great session. I hope all attendees found this session insightful, and we really appreciate everyone taking the time to join us today. Our contact information is on the screen. Reach out in case you have any questions or are interested in our Quick Start offer, and we will get back to you within 24 hours. We do have a great lineup of next webinars, and you can visit our website to find those details. And yeah, that is it. All right. Thank you again, and have a great rest of your day.